Hello, thank you for joining us once again in this our continuous enlightenment programs for to let people understand issues concerning joint and joint pain. For many people that are battling joint pain, this is a very important source of information that can help you on how to overcome your joint pain and joint issues. All right, so today we are going to look into another important topic, more like to let people understand that actually the painkiller you are taking can be worsening your arthritis. That sounds like an irony. I have pain and I'm taking drugs to lessen the pain, and how can I worsen the pain? As far as arthritis is concerned, if we are continuously taking painkiller, there's a danger that it is contributing to the worsening of the arthritis. And how is that? I invite you to pay attention. My name is Dr. May, the medical director of the Richards Clinic, the pain clinic, where we treat all kinds of joint pains using the latest innovation in treatment of arthritis known as regenerative therapy. And today we want to let people understand the danger you might face while you are continuously taking painkiller. And one thing we need to understand is, yes, pain, as bad as it may be, is actually a physiological response to injury. Physiological, it means something normal event that happens in the body. And how can pain be normal? For instance, imagine just like this lady who is jogging and maybe she twisted her knee or she had an issue in her knee. Automatically, pain will come. Immediately pain comes, the next thing that you do is either to slow down or to stop. That is the mechanism the body has to slow or completely stop continuous worsening of what triggered the pain. So the pain is a warning sign. So when it gives you that warning that something is wrong somewhere, all you do is to take up a method to stop worsening that. So this lady had just slowed down or had just stopped jogging. Until the pain goes down, she might start again. So it's a physiological response. So imagine one stops this physiological response. So what happens? The person stands at a danger to worsen what triggered the pain in the first place. Now, talking about what triggered the pain, I want to let us see how pain is generated in the body. Pain doesn't just come on its own. Pain is usually generated by tissue damage or sometimes by pressure in the joint. But this time around, talking about arthritis, it is all about tissue damage. So that tissue damage is the wear and tear in the ligaments and the cartilage, and other tissues of the joint like the synovial membrane and all that. So when there is an issue, something that has injured any of these tissues, it will trigger pain. Okay, so and how does it trigger that pain? It triggers this by generating certain chemicals, certain enzymes. That place might get swollen and all that. And that swelling is inflammation and it will not cause pain. So the normal thing one does is to manage that particular area. If it's a joint, you might begin to rest that joint. Or even if you don't do it yourself, that your body has a way to carry away your weight out of that joint. So if it's happening, for instance, in your right knee, when the time when you're walking, your body naturally tilts your weight towards the left so that you will not be injuring that right knee the more. Okay, that's the mechanism. Okay, so these are ways to prevent worsening of the condition. But the problem with this is that even what triggered the pain, the inflammation and all these chemicals that are released will be worsening that tissue damage or what triggered the pain in the first place. Okay, but what do we do? Naturally, we try to feel better by taking painkiller to reduce the pain. Okay, is that the right treatment? You'll be able to answer the question at the end of the lecture. Okay, so we take painkillers which can vary from normal painkillers to take like ibuprofen, diclofenac, meloxicam, all those normal out-of-the-counter medications we go to the pharmacy, nearby chemist to buy. They are all NSAIDs, non-steroidal anti-inflammatory drugs. Okay, this they generally come out in form of tablets, which we can easily get and take. Those steroids are they're majorly in injections. There are those that come in tablet like prednisolone, dexamethasone, which can be prescribed to us by some doctors. Okay, and opioids like tramadol, pentazocine, and all the other painkillers. So what do they do? You can see this is the tissue damage, but they do not mind, let me use the word, they do not attack or address the tissue damage, but they try to cut off the sensation of pain. Okay, then cut off the sensation of pain, thereby reducing how you feel the pain, which is like numbing the pain, giving the person the sense, the false sense of wellness. Yeah, the pain is down. Of course, I can do whatever I want to do. I can play football, I can run, I can go to my market, I can go to my office and all that. So one has that false sense of being okay. But is the person really okay? The answer is no. The problem is there. The root cause of the problem has not been attended to, but the signal the problem gives have been numbed. So if the person goes around doing his or her normal things, normal daily activity, the person might not know that he is injuring the joint the more. Just as I said earlier on, because you have pain in the right knee, your body naturally tilts your way to the left. But when you are taking painkiller and have that false sense of awareness, the body does not tilt your way to the left again. For instance, you move normally and you see yourself walking okay, but you are putting more pressure on that tissue damage, which will now continue to get worse. Coupled with the fact that the inflammation and pain, as we saw in the last slide, will continue to encourage the tissue damage. So with this, people wonder, I've been taking painkillers. In fact, I've even increased the number of painkillers I'm taking, and the pain keep on coming back and even getting worse. This is the reason. It is just relieving the symptom and not treating the disease. Another thing that happens in human body, our body is a very wonderful entity. Whenever there is wound in the body has natural mechanism to heal that wound. As I've always told us, arthritis is a wound inside the joint. Wear and tear is a wound. Okay, so in any wound in the body will try to send in nutrients, chemicals, oxygen to help and encourage the wound healing. And that is how it does that, is by burning off or initiating the formation of new blood vessels that will go towards that wound area. For instance, as you can see in this picture, that is what is known as angiogenesis. This is normal blood vessel, but there's a wound around this place, so it started burning off blood vessel towards that wound. So the blood vessel has branched off, and here it has matured. As I said, what it does is to bring in blood, which carries oxygen, nutrients, all what the wound needs to heal, the healing factors and all that, as well as the toxins, other chemicals, or unwanted products will be taken away through the vein to the blood and back, and removed out of that particular area. Now, what painkillers, what they do, especially when they have been taken for a long time, particularly the NSAIDs, what they do is that they hinder the formation of these new blood vessels. They hinder it or slow it down. So they help the new blood vessel would have brought to the wounded area or injured area will be hindered or practically stopped. Okay, so this is another way the continuous taking of painkillers can worsen arthritis. Another painkiller people take is the one, just as I mentioned, the steroid, which is cortisone. Many people have the habit of receiving or going to the doctor to ask, especially those who know, or some doctors, is also their treatment modality to inject steroid in the joint. Yes, steroid known as cortisone or the cortisone, depending on the one available with your doctor, It's a potent painkiller. Yeah, it's a wonderful painkiller. It can give you pain relief up to 6 months, 3 months, or even nothing at all. Some people are taking it and didn't feel anything better. Okay, but continuous injection of this steroid into the joint is a dangerous thing because it even contributes in the worsening of the joint and the cartilage. How does it do that? It softens the joint cartilage. Studies done have shown that it softens the joint cartilage and it also weakens the tendons and the ligaments. The collective effect of this is the worsening of the arthritis, because when the cartilage is not strong and firm and soft, anytime you stand on it, for instance, if the problem is in the knee, it cracks the more, it damages the more, it breaks up the more because it's softer due to the effect of steroid. And secondly, steroids slows healing process. The joint is trying to heal on its own, but as an injecting steroid there, it slows the healing process. And the weakening of the tendons and the ligament, as mentioned, also encourages the hypermobility of the joint, which also contributes to the cracking of the joint cartilage and even the bone formation of osteophytes and all the things we notice in people that have osteoarthritis. Okay, so if now the question now is, what do I do if I want to treat arthritis? There are 4 steps I usually tell everybody who ask me. 4 major steps which I would like you to take note of. Number 1, visit your doctor. You have to see a doctor. It is wrong for you to continuously, you have pain, you go to your nearby chemist or pharmacy to buy painkiller, that drug finished and you go again. As we usually say, yeah, it's good to do first aid, do things on your own, but when the symptoms no better, do what? See your doctor. So it can't continuously go and be buying medications because it calms you down, helps you to perform, and when the pain comes again, you go. So as the pain is coming up, it's good to see your doctor. Okay? So when you see your doctor should send you for diagnosis stage, because it's the responsibility of your doctor to actually find out what's causing the pain in the first place. Okay? It's wrong for a doctor, after looking at you and examining you, just write medications for you and tell you that, go and take your painkiller because your problem is pain. Your problem is not pain. The pain is the signal, is the symptom. There is something that's causing the pain, and the doctor needs to know that by sending you for a diagnostic test, and for as long as the joint is concerned, there are 3 major tests you can do: X-ray, MRI, or CT scan. These are called imaging diagnostic tests. So by the time you do that, you will now bring it back to the doctor to look at it and tell you what you are seeing. If the doctor makes a diagnosis of joint issue like majorly arthritis as the source of your pain, what the doctor is saying in essence is that there's degeneration in your joint. And it's when he sees those features of degeneration that he could now tell you that you have arthritis or you have degenerative disease or whatever happening in your neck or your lower back. If that is the diagnosis, the doctor should not write medications, whatever medication it is, Lyrica, pregabalin, painkillers. That doctor is simply treating your symptom if it's what the doctor did. The doctor has to look for a way to heal that degeneration. As long as it's still at the point where it can be regenerated, the best treatment is regenerative therapy. That what should be prescribed for you, that what should be recommended for you. Because what did that do? It will help to regenerate the degenerated tissues of the joint. Okay? If it has gone beyond what regenerative therapy can do, the doctor might have to recommend surgery for you. So, there is no way, if you are having chronic joint pain, somebody is still prescribing medications for you, that joint pain most likely will not stop. Okay? Now, how does regenerative therapy work? You could see, as we mentioned earlier on, where those painkillers work to numb the pain, and they practically avoid doing anything concerning the root cause of the problem, which is tissue damage. It is only regenerative therapy which releases what is known as growth factors, as we saw in our last lecture. If you have not watched it, I would advise you to watch it in our social media handles and platforms. Okay, so let's see how the growth factors are released and how they work. Okay, so when you now inject the PRP, prolozone, human stem cell, human stem cell or dextrose mixtures into the joint, these are components or modalities of regenerative therapy. So when you inject into the joint, especially this one is PRP, it will release the growth factor. Okay, the growth factor will now begin to repair that root cause of the problem, that tissue damage, that degeneration in the ligaments, the tendon, synovial membrane, in your cartilage, in your bone. All right. So that regeneration, which heals the degeneration, is what will eventually reduce the production of all these things, and finally the pain will go. All right. So this is how to treat the problem from the root cause. Taking medications which do not attend to the tissue damage, which is the root cause of the problem, is a waste of time. And this is practically what people do. When they come with bags of medications that have been taken, and I will tell them to throw that to the dustbin. If you are now doing tissue repair, repairing what has damaged in your joint, and you're taking painkiller to feel better while the healing is going on, it now makes sense. Okay, so because the main treatment, the major thing is going on, which is the healing. So as the healing is going on, and before the healing gets completed, of course you'll be having pain. It doesn't happen overnight. Some people it takes 90 days, some people it takes more than that, 90 days, 3 months, some people it takes less than that, depending on the stage at which you started this regenerative therapy. But before that could complete, you'll be taking your painkiller to feel better. All right. So, but taking painkiller alone with the hope that it is going to take care of your arthritis is a no-no. It's a mistake in treatment. Well, I will call it mistake because now we have gotten a treatment that can help. Before the discovery of regenerative therapy, painkiller used to be the in thing. But unfortunately, people are still dwelling on painkiller up to this point in time. They do not know there's something better in town. All right. So regenerative therapy is what to take care of the root cause of the problem and help the pain to stop. All right. So when we do that, we are now treating arthritis. Thank you very much for your attention to this lecture, and we help each other. There are millions of people who are suffering this problem, but they don't know the right things to do. They are continuously taking painkillers. Most people have developed stomach ulcer, kidney problem, heart problem, because of the dose of all these medications they are taking. That's why we are here, in our foundation, United Against Arthritis and Pain, is to help people to avoid all these complications of painkillers. If you are having joint pain, there's something better you can do, so that you won't see yourself month in, month out, year in, year out, dwelling on painkillers, which is very dangerous to our health. See you again in our next lecture.